How are we doing on the admin?
I think we have everybody joined. For those who are just joining, we're asking folks to please put your name and organization in the chat and what you're hoping to learn today.
Okay, give people that there's only a few messages in the chat, so we'll just give people like maybe a minute or two. Okay. Well, thank you, everyone. Welcome, Jim, Shelley, Susan. Okay. Okay, so my name is Nicole Schisler, and I am the president and CEO of an organization that's located in Cincinnati, Ohio. It's called Prevention First. And what we do is provide, we are primarily a prevention organization, and we provide prevention strategies into the communities. We're located, like I said, in Hamilton County, so we serve parts of Northern Kentucky, parts of Southeastern Indiana, and then most recently, in the past couple of years, we've been able to develop some workforce development strategies with preventionists. So we've been able to serve the whole state. So we are definitely in a portion of the state that can help with this data, and also our OCAM network, which is our training and technical assistance center that we run all of our trainings out of. And I am replacing Christy Valentini Lackner today, who is on jury duty for the next 5 weeks. So we are all trying to scramble and fulfill her obligations. And I appreciate and I ask for your patience today as I make my way through her presentation. And I'm looking forward to having some just really nice discussion. It seems like a lot of you, after reviewing this chat really quickly, as you begin a strategic planning process, that, or even just using some information locally. I know, Nikki, right? 5 weeks. So as you begin to understand and how to use this data locally. So I'm going to go ahead and feel free to interrupt me. I know that this will, I don't know that anyone has their camera on, which that's fine. That's me too. I wish I didn't have to. But I will ask for some participation, even if you don't turn your camera on, so that we can work our way through this next hour and make sure that we learn something along the way. So some of the things that we are hoping to gain today is look at the value of the OARRS data and creating a strategic plan for substance use prevention. I know a lot of you are from boards, so hopefully prevention is part of what you are asked to do in the community. We're going to look at identify some local efforts that would be enhanced by greater engagement with OARRS, and then take some time as a group in your breakout sessions and as a larger group to discuss how we might list individuals or organizations in your community who may benefit from receiving information about OARRS. I know that I am one of 4 in this series, and I was quickly updated on some of the things that have been taught earlier. So I'm not sure how many of you, this is like your 4th of the 4th series, and if so, please definitely share that information and experience that you've learned to date. I also know that Dr. Miracle was the 3rd presenter in this series, and she is on here today. She is not feeling well, so I definitely will not ask her to turn on her camera. But thank you for being here, Tessa. And then really just trying to look at some opportunities to really look at and apply some practical data. So what is OARRS? This stands for Ohio's Automated RX Reporting System. And I apologize if some of this is repetitive, but it is important to just quickly review and remind ourselves what this is. So some of the ways it can be used is to address prescription drug diversion, misuse, and abuse. This can be utilized as a patient care tool. Initially, when OARRS came out, it was really to help with we knew we were in a drug epidemic. And so now what it's used for is hopefully is more of a preventative tool. And so it really allows us to look at how we can take care of this drug epidemic and try to get ahead of it if we're starting to see some trends in these systems. And then it can be a drug diversion and insurance fraud investigative tool. So there's multiple ways that you can use this data. The PDMP interactive data tool is looking at, it can assist state and local partners in better understanding the distribution of the medications in their communities. So that looks at the State of Ohio Board of Pharmacy. They developed the PDMP interactive data tool, and I know they were the first two presenters in this series. And then they, you can look here for a combination chart. There's a map. This particular example here is the Ohio opioid prescriptions per 100,000 residents. There's you can look county to county. You can look gender comparison chart, age, and then the county table. So obviously we know that every state is different and every county is different, but it's nice to have the opportunity to look and see perhaps where your county falls. Svea, I saw you on here, and I know that from Athens County, there is a tad bit of a rural community down there. So you might not see the same numbers similar to those urban counties, but there is always pause for concern and to think about the differences in the data. So when we start to look at strategic planning, I'd like to know if you could just say or turn on your camera or type it in the chat if I can find the chat. And just say how many of you maybe have been part of a strategic planning process. And then if you have, tell me a little bit about the good, bad, ugly, or boring aspect of that. And so I would just kind of like to know who's been part of a strategic planning process and what that looked like for you in your county. Anyone willing to share?
I can share my experience. Hi, everybody. This is Tessa Miracle, and I'm in Franklin County now, but I've used OARRS data in 2 strategic planning processes, and we found it really helpful. So when I was part of a county level coalition, we used the data to identify, our high need areas. So it was actually like a tri-county coalition. So we were able to recognize which of our counties was highest need and which one, while still high need, could maybe wait a month for implementation. I've also used it at a state level, which was really helpful in seeing like where some of those needs clustered and seeing opportunities for programming and implementation.
Okay, thank you, Tessa. All right, I'm just reading the chat here. Yes, I agree, Susan. Sometimes even if you're at the county level or even where you have to interact with any level of a group, they can often want to come in there with their own agendas. And Susan, I can feel for you there. You're coming on and trying to implement a previously made plan. And Nikki, what were some of the top issues that came out when you were focusing on those on your strategic plan.
Sorry, I can unmute. Alyssa and I both have our computers open, so I'm hoping there's no interference with me talking.
No, you're good.
Okay, perfect. I was going to say that one of our top issues when we did the SPIF PFS was prescription drug misuse among youth in our county. So the strategic planning process really helped us with, focusing in on that evaluation and really the whole SPIF flower, which you had up before you went through some of the other slides.
Yeah, sorry if I was making you dizzy with that, but
No,
you'll see it.
okay.
It's coming.
But it was really, really helpful for us to just take the time to dedicate time to focus on each of those petals of the flower and make sure that, at the end of the day, what we implemented in our community was data driven and that it made sense for our community where they were with their readiness and things like that.
Okay. Yeah, and I know we just redid ours last year. I became CEO. It'll be 3 years in October, and our strategic plan had already hit kind of a 5-year mark, which is kind of long, but the board wanted to wait until a new CEO was hired and let that person that kind of be their leadership role. And really one of the things that was bothering me about this current strategic plan was that not all of the grant dollars that we were getting and the purpose of those grant dollars was in our strategic plan. So like you said, Nikki, is you were getting a grant to prevent, prescription drug misuse in youth, and you weren't, actually probably that purpose and reasoning was not represented. Okay, so coming to a consensus, I think the wording is the hardest part, Temple. I agree. It's really consolidating ideas. And then for anyone who has ever done any level of prevention, like it's just not language that just rolls off your tongue. So you have to take a step back. We did, at least with our board, unjargon it and then make it useful for the community. Why is this going backwards? Sorry, I'm just having a day here. So Nikki had mentioned the strategic prevention framework, and this is our go-to planning process for learning about how to either develop a logic model, how to develop a strategic plan. So the first, and we call it the flower, but I hope that some of you are familiar with this, and if not, it is an amazing planning tool that I highly encourage people to use. So really what you're looking at is gathering information to provide insights into problems and related behaviors. So you're looking at not only what's going on in the community from a numbers perspective, but you're also looking at it from anecdotally. Maybe you're doing listening sessions, and you're really trying to take as much opportunity to best inform the group, the room, the board, however that might be, of what type of data is being collected. So the first step in this process is assessment, and this is where we will spend some time today. Really, when you begin this assessment of the data that you have to guide a strategic plan, which it sounds like most of you are considering and or looking at how this data could best inform your community. So there's going to be an opportunity to examine different kinds of data, so that substance use and other behavioral health problems are complex. So understanding them requires looking at different kinds of data to get an accurate and complete picture of the problems. Two things that you can look at are the quantitative data and the qualitative data. So the way I remember that is quantitative with the N is the numbers part and qualitative is the L. I don't have anything that represents the L. I just remember it's the other part. So it's more of the quantitative is the straight up raw numbers. And then the other one is how do you, so what, like what else can inform this information? When you are really assessing this data, it's some of the questions you should be asking yourself are there any data gaps, anything that stands out to you? So gaps refer to the data that is missing and needed in order to answer the assessment questions. When there's missing data for specific population groups, the problems in a community may not be completely captured. What are some examples of maybe some data gaps in your communities that you've noticed? What do you feel that is missing as you begin? Maybe you've tried to look for data and you haven't come up with it. So what might that be? I know Tessa's having a heck of a time with the Drug and Poison Information Center trying to get some information for the statewide. Yeah, Tessa, there you are. Poison control data, right?
You were talking as I was typing. Yeah, I've had some trouble getting streamlined poison control data. I don't know if other folks have experienced trouble accessing overdose data or some data along those lines as well. Sometimes that can be a little challenging to get.
What are some other examples and maybe some gaps that you've experienced in your community? Thinking about looking at that, maybe all data are not created equal, very true. And then considering culture when examining the data, so that if you reference the spiff flower, you're looking at sustainability and the cultural competence. There she is. Hi, Nikki.
Hi, I was just going to say, one way we are seeing like a new data gap here is we used to be able to obtain some really, really interesting and in-depth data from ODH regarding overdose and suicide deaths through public records request. And they've recently had some legislative change that now their death report data is HIPAA protected. So I can no longer get some of the really in-depth data that I was able to get that really helped us with some of our planning, where we would, outreach, because we used to be able to get things like level of education and also things like where someone might have worked or industry they might have been in. So for a while, we were seeing like a really high increase of people who were in like the laboring, roofing and things like that. So we're no longer able to get that. So we can still use their database, but we don't get that specific data anymore because it is now HIPAA protected.
Wow. So, I mean, do they have any suggestions on, I guess they didn't really think about like our kind of people when they were making that, but I mean, I understand why, but gosh, that's so informative to have that information when you're thinking about helping a community.
Yeah. Well, and they really told us that this all came out from COVID because people were doing public records requests for death information because of that. And it all spiraled from there. And so now all of their death information is now HIPAA protected.
Oh my goodness.
Oh gosh. And I'm sorry if I can just jump in. Hey, Nikki.
Please.
I don't know if, given your relationship, if like a data use agreement would be helpful in that situation. You might be able to explore that, so that they're kind of like, you can find pretty standard ones. Like, I mean, like we think of the lease you can get at Office Depot and have people fill out. There are versions of a data use agreement that's like that really explicitly states like, we're just using this in strategic planning. This is exactly how we'll use these data. And sometimes that can facilitate that process for you getting more in-depth and more stratified data.
Yeah, we tried for a little bit with speaking with some of the upper, but it was very new. Like I sent a public records request and I was told that I could not get it because they were in the middle of litigation. And then I was, once the legislation passed, then that kind of changed. So I think that it's really new for them too. And they're very much like, here's our data warehouse. So for now I'm good, but we are going to be implementing in all of our counties, overdose and suicide fatality reviews. So we're hoping to get that more detailed data locally and not have to rely on the state level. It was just, catching up for those few years because as you know, data is behind like 2 years. 2020 is the last full death report data that you can find. So thank you for that. And maybe like when things settle down for them, that might be something that they'll be willing to look at.
Yes, and thank you. I should have known you guys were already exploring every avenue. And I think when something's new like that, it's usually like, okay, sit down for a minute. We'll be able to explore once we have more clarity.
I just saw Casey put into the chat that they have struggled with finding good data on non-fatal overdoses. From a county perspective, or maybe some suggestions for Ohio data, just quickly, does anyone have an idea on maybe some good ways to get some data on that? And she's with PIRE, so they're a evaluation center.
I know for us locally, we just build good relationships with our county EMS directors because they typically are, a lot of times they're doing the runs when someone's calling. So, and I know that's not all of the people who are non-fatal overdoses. That's just the ones who call 911. But that's kind of the best that we've got here.
A great idea. The other thing, I know here in Hamilton County, we have what's called a quick response team, the QRTs, and their responsibility is to respond to non-fatal overdoses a day or two after. And then they get information from the particular individual, and really their sole purpose is to get them help. So get them into treatment, get them to any other services they might need. So I say that, and I do believe that many counties have those QRT teams. So Casey, that might be something to look into. I can give you Hamilton County's QRT contact, and she is like, she knows all things QRT, and I know that they have monthly calls with other QRTs. So if you think that might be helpful, I'm happy to share.
Yeah, thank you, Nicole.
Sure. And before I leave this slide, I wanted to point out that in one of our logic models, not necessarily our strategic plan, but oftentimes in a logic model, you'll identify a problem statement. And in one of our logic models, our problem statement was actually not enough data is available for, and then, fill in the blank from there. But what that allowed us to do was really look deeper into that particular concept. So if we do not have, if that is our problem, not having the data is the problem, then let's have a discussion on maybe, who knows who, or even just like we've done here, maybe other ways that people can help each other get the data. And from a policy standpoint, maybe now, I mean, like Nikki said, that there's a huge challenge in their county with not being able to access that data. And I recognize that that's statewide, but it's also from their county perspective, that was something they relied on heavily. And now what do you do? So this is a nice discussion as well. When you're working in the assessment phase to identify perhaps what you want to consider in your strategic plan or from a local perspective, it's important to look at the community now and then at some point or time in the past. And thinking about the community and the state, or the community and similar communities, that's often identified in certain problem statements or goals and objectives, is such and such county or such and such board is a certain percentage below the statewide level for this particular piece of information, and then you can set some goals and objectives from there. So an example was Nikki indicated that for their prescription misuse in youth, I'm sure at some point in that plan was what the current misuse is for their counties, and then what was it from a state level. So then as a group, they can start to really look at why are our numbers so much bigger? Is it the way it's collected? Do we have a better data collection? So really looking at how we can utilize this comparison in a helpful way, not to say, we're better than others, but it's just like, has anyone seen how much bigger our numbers are, around this? And so you can see here that these are some of the questions that you would really want to ask those in the group that you're working with, is where have we been, where have we came. We just did this with our overdose data in Hamilton County. I'm part of the Hamilton County Addiction Response Coalition, and we released our annual report, which you can view online. And one of the biggest points was our overdoses had not necessarily decreased or increased, but stabilized. So with as much information that we know in comparison to the rest of the state, to other counties, it's really hard when your data is people, you can't make it sound like percentage of 20% or decrease. I mean, because you're truly talking about lives, but what we walked away with, where we were proud of the accomplishment that we had built relationships in our county to allow that data to stabilize, to get people the help that they needed. So sometimes you really need to ask yourself, how ready is a community for this information? So to accept that, even substance use or looking at the information in OARRS, what about this needs to change? So from a resource perspective, plus a readiness perspective,
didn't admit to anything.
quickly, where do you think
I'm
that?
sorry. I'm sorry, Nicole. I'm getting a little background noise. Can folks make sure they're
Yes.
muted?
I can see now that
Okay.
that has been muted, so I appreciate that. Thank you, Tessa. So when thinking about how ready your community is to look at this data and take in the information, what are some practices that you do in your community to take action to change that problem? So if you feel that your community is just not ready to accept any of this data or information, what might be some of the things that you've done, or what are some things that you would like help with? And by this, I mean, you go into a meeting and no one really wants to hear the data that you have because they either don't like what it says, or they don't feel it's relevant. So what are some of the ways that you can sell the data, or you have sold data in the past to show its value? And you can unmute or put this in the chat. And perhaps I can rephrase too, is do you feel that some of the problems that maybe you've identified in the past, have there been ample resources to match those that are identified? So did somebody come up with a strategic plan or a plan that you really didn't have the data to back it up, that you really needed to address that? Or you have no resources, no money, no services that can provide the backup? Has anyone experienced this, where you were passionate about a data point and you were unable to carry it forward? Okay, so I'm happy, or Tessa, go ahead. I saw that you unmuted for a second.
Yeah. I found in building the strategic plan, I think it works in the way that you were suggesting, and also in another way. So I have had an experience of like, build it and they will come. I think building the strategic plan has helped me really deeply formulate where I need to focus my efforts, or where my group needs to focus our efforts. So it allowed us to really target resources in a way that I feel like when your plan isn't fully developed, it can be sort of this enigma that exists like a cloud in the air, and many things can fit into it. But once I honed that down a little bit, I was able to find resources to support it. Mm-hmm. But I've also found it to be useful in not pursuing resources, because sometimes when we don't have as thoroughly developed of a plan, we can, oh yeah, I can see how that can fit in this. And all of a sudden we're about 30 miles west of where we meant to be. So I think I have found it useful. In my experience, I have had some some items on my strategic plan or some data points that, we had to form focus groups or we had to kind of gather those in different ways. And some of them, yeah, we did have to wait a little bit to get fiscal resources behind them. But I think once we had the data and the plan laid out, we were able to pull together like human capital. And that's just as meaningful as a large grant.
Mhm. Right, like maybe there is some partners around the table that we haven't even considered, and maybe they could, help us gather this information. Thank you, Tessa. So how can we track some of these things when looking at the PDMP interactive data tool? So there's a lot of handouts that can be utilized from the Take Charge Ohio. And included in some of that are the rules. So looking at the chronic and subacute opioid prescriptions, laws and rules for pain clinics, and then pain management agreement. So these are some resources that you can draw when thinking about how we might engage some local efforts, which is an example could be, how do we engage with our prescribers? And, for a long time, this really was truly the problem that we felt as preventionists and those working in the community, that it was on us to educate the prescribers. But I feel that this has gotten much better in regards to what they know about OARRS and utilizing it. So this could be helpful if you wanted to engage some physicians in your community, is just printing off these materials and really making sure that the physicians, the prescribers in your community know who your group is, know who the board is, and what you can do to help them get more information. And then that next level is the patient education. So again, you can take a look at this Take Charge Ohio. How can we track the following using the interactive data tool? So some of the tips that you might be able to give them is to ask your doctor before taking opioids, and then how to manage your pain, what approach is right for you. And then the state has really done a good job at this safe storage and disposal. Tessa and I are on a large statewide project right now that is one of the main focuses is, does every consumer that goes into a pharmacy know how to properly store and dispose of their medication? Maybe there's not a drop box there. Maybe they don't have doTERRA bags. Maybe they don't know about the next take back day in their county, but these are the types of things that we can educate them on. So then the overall general public, how can we track the following using the interactive data tool? So how do we look at some potential other ways to manage pain? And then it again just lists the safe disposal practices. I think we've all been doing this long enough over the past probably 10 years that we know that people are probably still not safely disposing of their medications. And then really educating the community on recognizing when someone is in danger. So if you're not familiar with some of this information from Take Charge, this can really help to educate the population. So who may benefit from receiving information about OARRS? Before we kind of conclude here, I'd like to take a couple minutes and go into a breakout session, and then we can have the opportunity to really look at, what is the best way to pull this information, as the pharmacy board did in those first two presentations. That is what their role was to show how to pull the data from OARRS. So you can go back and review that information. And but right now, what I would like for you to discuss in your breakout is listing as a group, come up with some individuals or organizations who may benefit from receiving your information. And then how will these individuals and or organizations benefit? So how will they use that information? So what is it? Who is it? How do they apply it? And let's do like 5 to
Nicole,
7?
I apologize. I'm not able to get breakout sessions working, so we may just have to do this as a larger group if that will
Okay, no
work,
problem.
or also through the chat. And I apologize about that. We're having some technical issues on this side.
No, that's totally fine. So let's take some time because I know this is important to a lot of you based on the initial introduction that you wanted to understand how you could best, utilize this data locally. So maybe if you could take like a minute or two on your own and write some things down. That way I'm not putting you on the spot. So let's just take like 2 minutes. I know silence is horrible. Especially it's horrible in person, but it's really bad on Zoom. So hi Charlotte, I saw you sneak through there. So take a minute or two and come up with some people in your or in your county that you really want to have you taken a closer look on how they can best be involved with this data and the next steps of moving forward. So you have until 12:43. All right, we're almost at 2 minutes, so be prepared to share some information because if you were in a breakout room, you definitely would have to share because it's a smaller group staring at you. Okay, we are at 12:43. If I could have individuals share what or who, well, no, actually, who would benefit from receiving information about OARRS in your local area.
I can go ahead. So Alyssa is sitting on the other side of me. So we chatted a little bit during that time, and we both kind of identified dentists. I don't believe are currently required to report into OARRS, but I think it would be beneficial for them to use some of that data. As well as I was just wondering about like veterinarians. Like, I don't know for sure if there's medications that are prescribed to animals that could be abused by humans, but I think, oh, thank you, Tessa, for
Oh, I was just going to
validating.
call on her.
For validating me in that thought. I feel like they probably, dentists might know a little bit more about it, but I think that maybe the veterinarians don't. So that's kind of what we thought.
You were spot on. Our veterinarians do not interact with our PDNP at all in the state of Ohio, but they do distribute, so that often they are distributors of medications. So if you go to your vet and you get the medication while you're there, they're actually dispensing. And they do distribute, schedule 2 through 5 drugs to animals. So if we think about benzodiazepine, doesn't care what type of mammal you are. it still works on you. So you're spot on.
Wow, wow. So thank you for that list. And just quickly, Nikki, what would you like, how would you approach that with the dentist? And
That's a
you
whole
might not
nother
have gotten that far, but I'm just like, from a speaking perspective, I wonder how you would open up that conversation.
We didn't get that far. I guess my very first thought would be, is there some sort of like regional dentist and vet meeting that I could go speak at? Because
I
to
don't
me,
know if
that's
they
like,
hang together, but maybe
well, I mean, I guess it would
separately.
be two separate meetings, like a regional dentist meeting and then a regional vet meeting. But maybe something along those lines, or if not, I suppose you just put a packet together, you go into the office and you hit the ground running and say, hey, have you heard of this system? And I would use a lot of the really great tools that I'm sure are available on the websites that you've talked about earlier. And the Tessa, I'm sorry, what's the actual name of the
The Ohio Dental Association has an annual
Ohio-
meeting. Yeah, go ahead.
OARRSdisposal.com is also
Okay,
our website
yeah.
that we created on SPIFRx, where you can request a disposal pouch or find a disposal location near you. But I just wanted to say, like, you were spot on with the Veterinary Medical Association. I love the idea of going to their board, but also I think the way you targeted local providers was a really meaningful way to work. Because I think of, like, in my job, if somebody I didn't know came to an annual meeting and was like, hey, you should do this thing, I don't know if I'd be as open as if I would be if it were someone from my local county coalition who I know they've done great things and I've seen them active in the community and maybe we've met before. So I like your approach of, working with a local provider first.
Yeah, I always think back to, there's like a regional, or not regional, but it's an area, like all of the clergy meets from the area. So I'm like, I don't know, do all the vets hang out? Maybe. And that's
Well,
how
they
I hang out.
probably, I mean, for their license, just like we have to get CEs or whatever, I'm sure that there is something they have to belong to as part of keeping their license. So that might be doing some investigating. And then there's probably like localizing of that. That's a great idea. What did some others come up with for individuals and organizations? Okay, Susan said port teams. What's that stand for, port? She also listed peers, hospital admin, specific medical practices in the health system. What does port stand for, Susan? Okay, I was just reviewing. I went back real quick and looked that you were from Adina's health system. So post overdose response team. Okay. All right. What about some others?
I'm not sure.
Oh,
if
you're
law-
fine. You're fine. I thought maybe you were catching up on Ozark because it comes out tomorrow with the second part or something. I'm just kidding.
I'm curious to know if, being new to this, if law enforcement already utilize this, like sheriffs. We're a rural community, Pickaway County, that, there's being prescribed to it and to have a better lookout for it, versus just like maybe a municipal law enforcement.
I'm not familiar if they have access to it. Maybe Tessa, you could answer that, or maybe others that have experience, but I think it would be definitely something to look into, Susan, if you have a chance, like even to open the conversation with your law enforcement about this tool, or perhaps there's things that you can print or download to share with them, because I think anything is helpful, and maybe that becomes part of your plan is, you are engaging in with law enforcement to understand and interpret the data to see how it can help on either end.
Definitely. So in the state of Ohio, law enforcement can access overall reports that are de-identified But in order to get a patient level drug use data, that patient has to be under active investigation. So if we're looking broadly, they do have access to reports, but they also have a more narrow access for individuals who are under investigation as well.
So I think perhaps, like Nikki said, putting together a packet of information about what OARRS is, how to best utilize it, how can we work together. And maybe the outcome is just, this is the data that we're seeing from OARRS for our county. And one of the things that we think will be really helpful is if all law enforcement start being supplied with deterra bags when they go maybe on a death call to make sure all the medication's out of the house, or however, just really exploring like the diversion pieces of that.
Nicole, I wonder if anyone here has engaged pharmacists in viewing OARRS as a individualized prevention or harm reduction tool. So talking to patients about, you have an opioid prescription, here are deterra bags, or do you have Narcan, since this is an opioid, or if folks had any experience with engaging pharmacists or interest in doing that.
Yeah, I'd love to hear from the group. I think that is, how have you worked with pharmacists in your area? And before, while you're typing or thinking about that answer, I know that one of the purposes of the Take Charge campaign that I showed you is providing the consumer with knowledge and education about how to best talk to your doctor about prescriptions. So it could be as easy as making sure that the prescriber knows how much medication you are other taking besides the one that you're being prescribed. That could be over the counter or whatever that might be. But really just engaging with them on that patient education piece. I know Montgomery County, I saw that you're on here, but I know one of the coalitions there, they have relationship with their pharmacists in the county, and they try to supply them with as many stickers as possible that go on top of the caps of the prescription bottles that say opiate. This is an opioid. If you do not know what that means, this is what has the potential for, to be addicted to this. And they only put it on opioids. They don't put it on all the medications, but it really is just that next level of flagging the medication to make sure that there is just that last final opportunity to let people know that this has addictive properties in it.
Yeah, I think awareness is important. I do want to share with you, just in case, I know we all kind of stay in our own lanes. So the Ohio Board of Pharmacy did pull together the red flag training for pharmacists. And the red flag training is designed to help pharmacists and other healthcare providers identify those red flags that would come up in an OARRS report. And they offer specific counseling kind of questions or some of those pieces to talk with a patient about. I'm fully aware that it's been a few years since that came out. So as we look to the Take Charge Ohio resources, as well as that red flag training, I wonder if there's an opportunity just to connect with local pharmacists and make sure they're aware of those resources and kind of uplift some pieces that have already been created.
And Tessa, if any, is there any monetary challenges with that training? Because that may be something that we could supply with our SPIF-RX dollars.
That's a good question. I think the red flag training has already been created and paid for. I think the burden would be on the pharmacist needing the time to take it, but I believe it was put out as part of their registration with OARRS. So this is part of what you have to do to gain access to the system, but we'd have to talk to Cameron about that and make sure that that is still correct. It's also been a few years, so people have moved. We have new people who have joined the workforce. So I think it's worthy of revisiting.
Yeah, I've never heard of it, so that's cool. I mean, I'm not like in a pharmacist, so I may not have gotten that information, but so thank you for that bit of information. I think that's cool. So some of the things or individuals and organizations that we pre-populated this slide with are judges and court personnel. I'm not sure how many of you are on this call are part of a community coalition, but I highly recommend it because that is a group of concerned community sectors that have come together to discuss a common problem in their community, and things such as strategic plans, logic models, data such as OARRS really drives their work in a proactive approach. Employers and businesses, patients, family groups, law enforcement, researchers such as PIRE. Tessa's a researcher. Anybody on here from higher education, university or college, there's always an impact that can be made through researchers, and then just parents and educators. And I think this is probably a whole other training, but really it's, how can we make one-pagers or handouts from OARRS that can really simplify the data and inform people of what's going on in the community. And I reviewed back into the chat. I know a lot of you at the beginning said that you wanted to learn how to incorporate that local information, bring the OARRS data, locally use and interpret. So if you haven't had a chance to understand how to utilize OARRS, that was not the intent of this presentation, but I do believe it was in the first two. So Casey, I don't know if those have been recorded and posted somewhere, but I'm sure we can make sure that people get that information that they need to understand how to pull data from it. And what we hopefully this was helpful today for you to understand just how to incorporate others. And I would encourage you to really look at this group. I know you can see all my business now with my notes and things, but these individuals and organizations really are really where you're going to get that qualitative data that's going to inform some of your work. How do we know what we need to work on, or what is our most common problem if we're not truly asking the community? And it looks like Casey posted the communities of practice. The
Yes.
OARRS webinars maybe are there.
Yes, that's where the recordings will go. I don't think they're all up yet, but they will be. So
Okay.
Folks want to check back there. You'll have the recordings as well as slides.
So if for whatever reason this webinar did not meet some of your interests with that, that's something that you can go back in and learn, or we can take some feedback and offer some more trainings. And if not through this particular venue, we could also offer it through the OCAM network, which I shared with you, that little tiny logo right there. That's ocamnetwork.org is all the training that takes place in Ohio in regards to prevention. So we have approximately 2 minutes left in this fantastic learning opportunity. Any questions, concerns? Are you awake? It's mid-afternoon. Maybe you're hungry.
Thank you so much for all the information. I don't have any more questions.
You're good. Yes. Thank you. Good, Temple. Thank you. I'm glad that that was helpful.
And just a little bit of housekeeping, we will send out an email to all the participants with a link for an evaluation survey. So please fill that out. That's how you'll get your CEs.
And I posted my email. And if you were a groupie of Christy Valentini Lackner, and that's the only reason you came on this webinar, I do apologize. But if you need to talk to me, I'm more than willing to help. And if I cannot answer your question, I can certainly find the answer. I'm very good at that. All right. Thank you. Thank you, Allison. Have a good day. All right. We are right at.
Thank you very much.
Oh, thank you. And looks like we are just right about 1 o'clock, Casey. So is there anything else you want to say before we end this?
No, I think that's it. Thank you, everyone. And thanks for those of you who attended all 4 sessions. We're hoping we can do more learning opportunities in the future. But please reach out if you have any difficulty getting your CEs, or if you don't get the email, you can email me specifically, and I will put my my email in the chat. Thank you all so much.
Right. Everyone have a great day. Thank you. Thank you, Casey. Nice to meet you.
Thank you, and thank you for stepping in for Christy.
No problem.
Hopefully,
You'll be hearing from me later.
well, hopefully she doesn't end up spending 5 weeks in jury duty.
I know. I feel so bad for her, but she'll be okay.
It's a long time.
I know. And they get $19 a day. Did you know that?
Is that
Like,
right?
what is that? That's embarrassing. I'd almost rather have nothing than $19, and parking is $6.50.
Of course. Yeah.
Mhm.
Yeah. Wow.
All right. Well, have a good one. Thank you.
Thank you. You too.
Bye-bye.